I'm Dr. Daniel Kraft. I'm the faculty chair for medicine at Singularity University and the founder and chair for Exponential Medicine, a program that looks at the future of healthcare. One of the things that's starting to shift into our healthcare system from the sort of sick care model we have around the planet is to understand that while our genetics, for example, are important to our risk for disease, our disease and our costs to society are much more driven by our behaviors, whether it's obesity or stress or drinking and alcohol habits. Those are behaviors that we can start to measure in new ways. The connected accelerometers on our wrist, I'm wearing a couple of versions today, can start to get a pulse on our steps and our sleep and where and how we're operating. So if we can start to now kind of digitize our behaviors, we can start to leverage them to keep us on a healthier path, not waiting again for disease to happen and treating a heart attack or a stroke or finding cancer late, but to use this more continual data to be more proactive, both individually and across communities and society. You can go online and buy a connected blood pressure cuff or scale or step counter and use that data to give yourself personal insights and to drive and change your own behavior. You can get your own personal genomics done on a variety of websites and use that information to tune your prevention or potentially choose what drugs and what doses you might take. I don't think it's just government's job. Sometimes government can set the policies. For example, give a bonus for physicians and hospital centers for using electronic medical records so some of the data can start to flow in this era of digital and connected and mobile health. But they're not going to create some of these new apps and platforms, but they can create the environment, the incentives, how you reward a primary care doctor for using some of these new technologies and apps to help manage a diabetic patient or a patient with high blood pressure so they can have a better feedback loop and be controlled. That comes from policy and how we pay for healthcare. There's so many healthcare systems, even in the United States, we have the Kaisers and the VAs and the Geisingers, which are sort of pay-or-player models, to the many fee-for-service organizations. And they're starting to think in this way. If you engage your members of your hospital system to lose weight and pay for their wearable devices or give them a bonus for doing a meditation class or to quit smoking, which will downstream lower healthcare costs dramatically. Those things are starting to happen. We're starting to see healthcare systems and insurance companies pay for apps that will take folks who are pre-diabetic, about to become very expensive sick diabetics, and put them in a social network and track their weight and their activity and turn them around. There's lots of challenges with some of these new fast-moving technologies: personal genomics, digital health data, and privacy. Who owns the data from your own body, from your pacemaker, from your genome, from your wearable device? And yes, there are privacy concerns, but we need to be smart about using other technologies like blockchain to make that more controlled, so you can opt in to share when you like to. Because if we don't learn to share and cross-fertilize some of this, it'll remain siloed in academic institutions and electronic medical records that don't talk to each other, and we'll lose some of the great opportunity to collaborate.